On these ultrasound images, you can see that the uterus appears large, globular, and somewhat heterogeneous, right? It just looks abnormal. Now, it's hard to tell what exactly is going on an ultrasound, but I think just based on the ultrasound images alone, I would suspect that this patient with pain and dysfunctional bleeding could potentially have adenomyosis. And if you look at the MR, you can see that that is clearly the case, right? This junctional zone is massive. It's thickened throughout. In certain locations, the junctional zone measures up to about 2 centimeters. This is a classic appearance for adenomyosis. Notice how this is the diagnosis that is contingent on the T2 weighted images and is not possible in either the pre-GAD T1 or the post-contrast images.